Good evening. On behalf of all of us here at the School of Global Public Health at New York University, our Dean's Council, Program Advisory Board, faculty, and staff, it is my personal privilege to honor and welcome you to our 2021 graduation ceremony. Congratulations. This commencement marks many firsts for us. You are graduating during a global pandemic, which may be abating here in the US and in other well-off countries, but sadly is raging around the world. Thus, your intellect, skills, passion, and compassion are desperately needed. Your own past year has been disrupted by so many unforeseen obstacles, and you have navigated them brilliantly, and also simultaneously taken on many important roles to help stem the tide of COVID. It wasn't easy for any of us here at NYU, but this is especially so for each and every one of you. Some of you have lost family members and are still battling this virus here and abroad among your families. We all mourn your losses. You are part of the largest graduating class to date at GPH, and you will be followed by yet another record-breaking class because the steep demand for public health training and skills has skyrocketed, and we need you now more than ever. You all have earned your degrees from one of the top-ranked schools of public health, rising 6 places in the US News and World Report rankings in just the past 2 years. You are also graduating at an inflection point in our nation as we battle twin epidemics, COVID-19 and systemic racism. The skills you have honed over the past several years will no doubt serve you and the world well. Resilience, tenacity, flexibility, and commitment. You are no doubt familiar with our school's dedication to reinventing the public health paradigm. In light of the pandemic, your graduating class has learned exactly how vital it is to reimagine and rebuild our public health infrastructure. And you're now poised with a unique experience to make that mantra a reality. We look forward to all the achievement that lies ahead for you as you begin or continue your own remarkable career. It is my distinct pleasure to welcome the president of NYU, Dr. Andrew Hamilton, who has been a tireless champion of our school. President Hamilton.
Thank you, Dean Healton. I'm delighted to say a few words to the tremendous School of Public Health class of 2021. But before I do that, let me say a few words about you, Dean Healton. In particular, I want to thank you for your leadership these past 9 years. You have been an inspirational founding dean of NYU's new School of Global Public Health, and you have taken it from a standing start to one of the preeminent schools of its kind in the country. Thank you. But graduates, this day is especially about you. Your achievements, your goals, your talents, and yes, your determination. This past year has brought challenges and upheavals that none of us foresaw when you began your studies, but you have met them with resilience and creativity, and each of you has succeeded in a rigorous course of training and scholarship. Because of the pandemic, public health is now discussed at kitchen tables and street corners all across the country, sparking interest in this growing field as never before. In fact, applications to NYU's School of Global Public Health have nearly doubled since last spring. But you knew the importance of public health long before it became a household phrase. The NYU community is filled with pride as you prepare to launch your careers in a field that touches so many facets of human well-being, from global pandemics to environmental health, to chronic conditions, to health equity. We can't wait to see how you will make an impact for the better. There's another reason we've seen a dramatic rise in attention to public health this year. A person so influential that they even named the phenomenon after him, the Fauci effect. We are thrilled that Dr. Fauci has taken time from his many pressing duties to be our keynote speaker this evening. Dr. Anthony Fauci is director of the National Institute of Allergy and Infectious Diseases at the US National Institutes of Health, where he oversees an extensive research portfolio focused on infectious and immune-mediated diseases. He has made seminal contributions to basic and clinical research and is one of the most cited biomedical scientists in the world. Dr. Fauci was one of the principal architects of President George W. Bush's emergency plan for AIDS relief, a program that has saved millions of lives throughout the developing world. He also led the response to the US AIDS epidemic, along with colleagues from the Centers for Disease Control and Prevention. Since the pandemic began, he has been an essential, nearly daily presence in our lives, thanks to his countless briefings and interviews. As a fellow scientist, I know I echo the sentiments of millions of Americans in expressing my profound gratitude to him for providing a voice for science, data, and fact that cut through the chaos and doubtless saved many, many lives. It is my privilege and pleasure to welcome your NYU Global Public Health graduation keynote speaker, Dr. Anthony Fauci.
Members of the faculty, distinguished guests, family members, and friends of the graduates, and you, the 2021 graduating class of the New York University School of Global Public Health. It is a personal pleasure and a privilege to speak at your commencement, and it is truly an honor to speak to the graduates of, as U.S. News and World Report states, one of the nation's best graduate schools of public health. This is an extraordinary time to enter the field of public health. The challenges posed by the COVID-19 pandemic at home and abroad have brought into sharp focus the world's need for the science and art of public health professionals and the imperative of robust support of our public health enterprise. The COVID-19 pandemic has upended our entire planet, challenging past assumptions about our preparedness for a global pandemic. In that regard, COVID-19 has at least 4 characteristics that have allowed an historic assault on humanity. First, it is caused by a virus that, to our knowledge, never had infected people in a sustained manner. Second, the virus is extraordinarily efficient in transmitting from person to person. Third, it has a high level of morbidity and mortality, especially among seniors and those with underlying comorbidities. And fourth, like so many other diseases, such as HIV, TB, diabetes, kidney disease, and others, COVID-19 has exacted a disproportionate toll in minority communities, especially African Americans, Hispanics, and Native Americans. It indeed is the perfect storm of an emerging infectious diseases, or, as I have worried about for years, my worst nightmare. And so, the expertise, energy, passion, and commitment you soon will bring to the world amid COVID-19 come at a most opportune time. Rarely before has the world so badly needed the skills inherent in the many disciplines represented by this class: epidemiology, biostatistics, public policy, community health, health economics, and many, many others. Public health in 2021 is truly, to use the parlance of business and economics, a growth industry. I must tell you, the immediate and urgent need for the talents and training that you possess were much less apparent when I was embarking on my own career in medicine. In 1968, I completed my residency in internal medicine right here in Manhattan at the New York Hospital Cornell Medical Center, now called New York Presbyterian Weill Cornell Medicine. Around that time, various health experts and pundits had opined, believe it or not, that the threat of infectious diseases was nearing an end. This view was rather widely held. Great advances with medical interventions such as antimicrobials and vaccines had engendered great optimism, and some went so far as to suggest that it was time to close the book on infectious diseases and shift public health resources to chronic diseases, thus, in my mind, adding new meaning to the word provincialism, since malaria, tuberculosis, vector-borne diseases, and so-called neglected tropical diseases continue to rage in low and middle-income countries. Against this backdrop, in 1968, I was on my way to begin, of all things, an infectious diseases fellowship at the NIH in Bethesda, Maryland. As I drove through the Lincoln Tunnel and then south on the New Jersey Turnpike to my new job, the words of the pundits, many of them renowned experts, rang in my ears. I had a sinking feeling that I might be obsolete even before my career had begun. A bit like training to be a VCR repairman. Unfortunately, the pundits were dead wrong. They declared victory prematurely, and for the football fans among you, this was sort of like spiking the football on the 5-yard line on an open field run. For, at about this time, scattered cases of a strange wasting disease were being noticed by missionaries and healthcare workers in sub-Saharan Africa, off the radar screen of the Western world. The sparks of the HIV pandemic had already become a low flame, and soon a growing fire that transformed the world, and for me, my professional career, if not my entire life. Of course, in the 40 years following the recognition of the AIDS pandemic, we have seen dozens of disease emergences. The past 12 years alone have brought H1N1 swine flu in 2009, chikungunya in 2014, Zika in 2015, and multiple outbreaks of Ebola in Africa from 2014 to the present, to name just a few. Now, obviously, not every opportunity or challenge that you encounter will influence your careers and your lives or be as dramatic as a frightening infectious diseases outbreak. However, please believe me when I tell you that something akin to the unpredictable events that I have experienced in my own life and the evolution of my career are going to confront you regardless of what directions your careers and your lives take. And so, expect the unexpected and seize opportunities to make a difference when the unexpected arises. Over my career, I have learned that when a new health challenge emerges, it is critical to not downplay its severity and never ever underestimate its potential to become endemic or worse, pandemic. We have been through this over and over, and usually we only see just the tip of the iceberg, or to use another metaphor, the eyes of the hippopotamus, while the vast burden or potential burden of diseases lies quietly beneath the surface. Consider HIV and AIDS. 40 years ago next month, in June 1981, we learned of 5 gay men with a strange new disease without a name or an etiologic agent. Then 1 month later, an additional 26 young gay men, then injection drug users, heterosexuals, infants, and thousands of others in the Western world before we even began to appreciate the huge and growing burden in sub-Saharan Africa. Still, some suggested that the problem would go away or stay confined to mostly marginalized people. But as we would painfully learn, the body of the hippopotamus lurked beneath the surface. Fast forward 4 decades, we now have 78 million people having contracted HIV and more than 32 million have died. With COVID-19, I am sure many of your own mentors, have felt a certain deja vu, with promises that the pandemic would disappear like magic, even while the pandemic surged with tens of thousands of cases and thousands of deaths each day. at a time when we should have been focused like a laser on the historic challenge facing us, when decisions on public health messaging should have been driven by data, we too often heard happy talk. As has happened too often before, victory was declared too soon. We must not let that happen ever again. When a new public health crisis arises, if it feels like you are asking too many questions or issuing too many warnings and communicating too much, then you probably have it just about right. When COVID-19, as with HIV and previous outbreaks of unrecognized pathogens, the scientific community had a steep learning curve. We have learned collectively to be open-minded and humble enough to change our recommendations, our guidelines, our policies, depending on the evolving data. If a situation is static and does not change, then stick with the data at hand. If the situation is evolving before your very eyes, follow the science and go with the data as it evolves. If you look at what we knew 15 months ago compared to what we know now, our understanding of COVID-19 has grown almost exponentially. The role and utility of masks in blocking transmission, the spread of SARS-CoV-2 by asymptomatic and pre-symptomatic people, and the importance of aerosol transmission, especially in indoor closed spaces. All of these evolved dramatically and rapidly, as did our understanding of the pathogenesis of the disease and how to treat it. We must always let data drive our decisions. In the current pandemic, our response has sometimes been distracted and precious time and resources wasted by the inclination to just try something, anything, a Hail Mary pass, if you will, based on anecdotes or a hunch that it might work. Unproven drugs were touted on the internet and social media by politicians and even some medical personnel, who sometimes made the incorrect assumption that the benefit of these approaches would outweigh any harms. Randomized controlled trials of many off-label therapeutics often eventually proved a lack of efficacy and in some cases even revealed severe adverse events or worsened outcomes. One notable example was hydroxychloroquine. Ultimately, numerous randomized controlled clinical trials showed a lack of efficacy for hydroxychloroquine and a concern for safety. Meanwhile, rigorous trials have proven the utility of several therapies in both outpatient and hospitalized patients. That is, we now have interventions that actually help patients. I would like to leave you with one final thought. Our country's experience with COVID-19 has put a spotlight on one of the great failings in our society, the lack of health equity. COVID-19 has exposed long-standing inequities that have undermined the physical, social, economic, and emotional health of racial and ethnic minorities. With COVID-19, many members of minority groups have had a much greater risk of COVID-19, often because of the nature of the jobs that many of them have as essential workers in society. More importantly, when people in minority groups are infected with the coronavirus, they have a much greater likelihood of developing a severe consequence due to the elevated rates of underlying conditions, such as hypertension, diabetes, obesity, chronic lung disease, among many others, that lead to a multifold increased risk in hospitalizations and deaths. Very few of these diseases are racially determined, and almost all relate to the social determinants of health, dating back to conditions that many folks find themselves in from birth, such as limited availability of adequate diet, lack of access to health care, and the restrictions and pressures put upon them by the undeniable racism that exists in our society. Let us promise ourselves that our corporate memory of the tragic reality of COVID-19 An infectious disease that insidiously and desperately hospitalizes and kills people of color does not fade after we return to our new normal. It will take a decades-long commitment for society to address the disparities that once again emerged during this pandemic. I strongly urge you to be part of that commitment. We must together find the strength, wisdom, empathy, and kindness to address entrenched elements of injustice, manifested in so many ways, subtle and overt, and we must work with all our might to remedy the cultural disease of racism, just as we fight the viral disease of COVID-19. If ever there was going to be a real incentive for us to make a commitment to address these social determinants of health, it has got to be now. Thank you again for the honor of speaking to you today. Congratulations to you, to your families, and to your loved ones. Good luck, and God bless you.